learning, it leads to plagiarizing in the best of the cases, right? Where you mimic the object, and you think you know what the object knows, but in reality you're just plagiarizing. Now your patient was aware that she was plagiarizing and could say it. Well, oftentimes people are not consciously aware that they are plagiarizing, and they are just aping someone, believing that they are the someone that they are aping, typically someone that they admire.
Well, then it becomes clear the connection with sadism, because it's a kind of violent appropriation.
Absolutely.
Rather than a meeting.
Exactly.
Some kind of exchange.
Right, right. I mean, one could make the comparison of the baby at the breast, just as a template, as you said before about rules, right? If the baby can bear not being the breast, it can have the breast. It can explore the outside of the breast with the mouth or the gums, let's say. It can take in what the breast has to give, which will allow him also not only to nurse, but will allow him to know something about the breast.
You can have a relationship.
Right, and a relationship that leads to both get fed and getting to know that object.
Right.
Not in totality. The baby will never be able to get inside the breast. It will only be able to get to know some aspects of the breast. That is the outside, the temperature, the texture, that it has a nipple, that it secretes milk, and so on. What the intrinsic mechanism is of the mammary glands that produce it, that the baby will not know, and the baby will have to be fine with not knowing that. If the baby can bear that tension, that wish to know will get displaced onto other objects, right? At a certain point, if the baby could consciously talk, it would say, well, I have to give up on this one, but I may be able to, let's say, the day of tomorrow, become a geologist, right? And dig holes into the planet Earth and get to know what is 10,000 or 30,000 feet under the surface, but I can't do that with the inside of the breast or the inside of my mother. If the baby gets too frantic about not being able to get to know what is inside the breast, it could use its first tooth, for instance, to bite really the breast of the mother, trying to get inside with the teeth, and the mother would say, ouch, and would turn the baby away because it's very painful, and the baby would then continue being sadistic and would have to do something with it. Either it will have to inhibit the sadism in order to be able to continue getting nursed, or it will have to shut down, right? The baby will have an early weaning. Nothing, will reject completely the breast for fear of destroying it, or it will turn its sadism towards other objects. And you typically see little babies aged 6, 8, 10 months with the fingers trying to get inside little toys. Right? Right. Claudette is saying inside the nose, inside the ears, inside the mouth. Yes. Well, I think we should finish for tonight.
Yeah, we never get to the end, huh?